NHS Improvement was asked by the Secretary of State to launch a national retention programme. There are many excellent examples up and down the NHS that we've seen that organisations are already implementing comprehensive and successful strategies to support organisations. Mid Yorkshire Hospital's NHS Trust has already implemented a programme of work to support their early years transition staff when they're newly starting within clinical practice.
We know from our flow of nurses through the organisation that at about 12 months we lose about 40% of our new registrants previously, which was something we had to take very seriously and work to improve. But it was really important that we asked the frontline nurses.
We've implemented a graduate nurse programme which gives the new nurses the theory and the tools and the support, so as when they start out in practice they can manage that difficult transition from being a student to being a qualified nurse.
She came to see us whilst we were on placement, made sure that we were okay, set up workshops every so many weeks just so that we sort of graduated from being a student into working for this particular trust, and just getting sort of a feel for familiarities within this trust and people who we can go to.
The difference we've seen this year is that we've employed 96% of our nurses from our local university, when last year we only employed 44% of those that we offered posts to. So the graduate nurse programme has really helped us engage nurses and get them, I suppose, hooked into the organisation so that they come in and they understand our culture and ethos and values.
From a patient's point of view, retention of staff is very important, that patients are seeing the same staff members, that you're not relying on agency bank workers as well. And the navigation programme is a key change. Staff spend an amount of time on the AAU, move to a different speciality, and then a new nurse comes on to the AAU. I feel that's very good because they're transferring the skills from ward to ward.
The investment in the new nurses, it's an honour to be part of it really. They can reach out at any stage during their career and we'll help them with whatever they need as they go forward.
The NHS staff are its greatest asset, and it's really important that we value their contribution to delivering outstanding care for our patients, service users and clients across the country. The national retention programme that NHSI is leading is to ensure that each organisation is developing plans to support best practice and ensure that their staff are retained.
Thank you for taking the time to watch the video. I appreciate it. Now I'm asking you to do the same. Would you please spend time to do a video as well, so you can share your stories, share some of your successes and your challenges, and perhaps some of your mistakes too. Please share it if you can on Twitter, #NHS Retention, or if you want to email us your video please on nhsi.workforce@nhs.net. Thank you.